Continuing our series on women's health, today we have Dr. Ladan Hariri. Dr. Hariri is here to talk with us about perimenopause and menopause. We'll talk about what those terms mean. We'll talk about symptoms of menopause, treatment options that are available, and conditions that affect and cause menopause to occur earlier.
Yes, this is a very important topic, but I think is not paid attention enough. The perimenopause and menopause can be because of the age range difference in different culture, can affect from many symptoms like GI tract, cardiovascular, and it is a very important topics that the majority of physician as well as the patient be aware of it, so they can get proper diet help to be able to sort of survive or manage this period in their life.
As always, if you like our videos, hit the subscribe and like button. Share the word about our podcast. We're trying to reach as many people as possible. Thanks for listening. And without further ado, here's our interview with Dr. Ladan Hariri. Welcome to Two Docs Talk. Today we're with Dr. Ladan Hariri. Welcome back, Dr. Hariri.
Thank you for having me back. I love this group.
We're so much looking forward to it. We have learned so much from you, and we're looking forward to learn more. Today we're going to talk about menopause. Can you tell us a little bit menopause and the stress? Let's start with menopause by itself.
So we always kind of make a joke. I think in the psychiatric community, at least the psychiatrists that take care of women, it's like menopause gets all the press. Everyone knows about menopause, right? But no one ever talks about perimenopause. Who's peri and who is that? So just a quick introduction, just in a nutshell for everyone that's listening. Menopause is the official time when your period hangs up its hat, officially retires. Average age of onset of menopause in the US currently is 51 years of age. So menopause is officially defined that you missed 12 consecutive periods. So you haven't had your menstrual period for a year, right? Perimenopause is that messy, confusing, in-between stage where menopause is about to happen. So, I don't know about you guys, but in general, when you think of someone who's about to retire, typically like the last couple weeks before, like when we were students, right? Back in school, when we were kids and we knew that summer break was around the corner, that 1 month right before summer break starts, you kind of take it easy. You start to get a little messy. Maybe you're not doing as good of a job as you usually do. That's like perimenopause. Okay. It's just kind of messy, and it's kind of the warning that things are about to end. So your hormones are fluctuating. Nothing really makes sense. Your cycle doesn't make sense. Maybe you're bleeding too much. Maybe you're not bleeding enough. Maybe your periods are too long or your periods are too short. And you're just left wondering, what's wrong with my body? What is going on? You're experiencing hot flashes, but you didn't even know what a hot flash was before. Essentially, your ovaries are having like a rave party. It's so confusing for your body because it's getting ready, and your brain is remodeling, and your body is remodeling, and your hormones are remodeling, and your body doesn't really know what's going on. So if you want to think about it, if menopause is your final destination, perimenopause is the really, really, really unpredictable road trip to get there. You're going to get flat tires and potholes and run out of gas, but your final destination, woohoo, is menopause. In a summary, I don't know if that makes any sense.
Definitely. Well, my wife went through all of these things, and I really sympathize for her because the room can be hot, cold at the same times, and seeing a little change of the weather can make her sweat. Yeah, so it's really I appreciate what she goes through, and it's a very tough, and without no explanation, just things are happening, but the feeling with it can be very burden for the quality life.
It's a very helpless and confusing feeling, especially for women, especially because as a woman, it definitely affects the way that you dress. It's like, oh, all of a sudden I can't wear a silk because I have to get it. It's just, it affects everything about how you live your day-to-day life. And especially in perimenopause, no one talks about perimenopause. Until I became a physician, I had no idea what perimenopause was. And the more I learned about it, I kind of looked at myself in the mirror. I thought, wait a minute, is that perimenopause that's staring back at me? Because here's the truth of it. So again, we said menopause happens at the age of 51 on average. Perimenopause can start as early as like 8 to 10 years before that. So that's 41 years of age. And then what we're also noticing in terms of trends is it seems to be that the more, and remember, this is all very dependent on women that report their symptoms to their physician. These numbers come from data that has been collected. So now we're wondering, is it possible that it actually can start 10 to 15 years earlier than the onset of menopause? Um, Full disclosure, that would definitely include me. So but it's really confusing. If you don't know what's going on, you just think, great, I'm a sweaty farm animal and I should not be allowed to enter public life. It's oftentimes I do feel very sorry for my son and my husband because I swear I love all my windows open. And I feel like more recently I've noticed that they always complain that they're too cold. And I say, I don't feel cold at all. So if that sounds familiar to you ladies out there, we might be in the same boat.
Yeah, and it's very, very difficult. And culturally, it's different, right? Africa versus Asia versus Western world is a little bit different, isn't it?
So Dr. Abbas, I think I want to hear your perspective on it. So I'm married to a Midwestern white American male. They love air conditioning. Like they love. I grew up in an Iranian household where you don't look at the air conditioning control. I don't even know what it's called. The thermostat, is that what it's called? The thermostat. You don't look at it. You don't touch it. You don't even think about it. You open the windows because I was taught, I don't know, maybe it's just that my dad was being frugal. Probably that's it. But I was taught that air conditioning is very bad for the health.
Yeah, sinus and drainage and all in our culture, right?
Is this a cultural thing?
It's cultural thing and some truth to it because people with COVID, they thought the recirculation of the air is not very healthy for you. So for us, is opening the window is the key to things. So fresh air, bring it in. Even in China, the same thing. As soon as in the evening, I mean, even it could be cold. They say, oh, we need fresh air. You need to open the window so to get some air. So I think it's cultural and
I feel validated. Thank you. I feel so. I just thought I was being maybe frugal because I also do think about that. I'm like, the air conditioning is so expensive, you know?
well, depend where you live. You live in Arizona, you have no choice.
Yeah. No, but if you live in lovely, we're the spoiled children of Orange County. I mean, you have choices, but my husband seems to think that the only choice is air conditioning. But now, yeah, I always wonder, I'm like, is it us? Is it you? Is it me? I don't get it. There's nothing like having all the windows open.
We'll go through the same thing. Don't feel bad.
Thank you. No, that's super, super validating. Thank you. But again, those sudden temperature changes. So, you know what it is with a hot flash. So when you hear hot flash, the technical definition is, and it's different depending on the article that you read, but it can be a 3 degree to 7 degree sudden increase in body temperature, like core body temperature over a very short amount of time. I sometimes question the 7 because a lot of the articles will say like 3 degrees to 5 degrees. But the point is, it happens in a very, very short amount of time. And the vasodilation, so all of your vessels all of a sudden expanding in your body, makes you feel like your body's just on fire all of a sudden, and you're profusely sweating all of a sudden, and you can't even tolerate the clothes that are sitting on your skin. It kind of becomes like a sensory distortion type of a situation, but it depends on the articles. I don't know what your patients tend to report to you, but that tends to be in the literature is 3 degrees to 7 degrees.
Yeah, and I think culturally, and also I know couples that they have to open the window all night, even during the winter time, because she's very, very hot, and at the same time the other person has to put a cap on because it's so cold. So it's yeah, it's different. I think person to person, also I think based on their body mass as well. So that makes it is a whole changes of it's a syndrome, I think, more than just individual person symptoms.
So, actually, okay, so this was one of the really interesting things that I read in some of the articles because, when you're on Doximity, it suggests articles for you. And I think Doximity knows that I particularly like reading about women's health. So, do you know that there is a trend coming back from open? So you know how it's always been open concept house, and husband and wife share one master bedroom. So there's a growing trend apparently in architecture of bringing back the Mr. and Mrs. separate rooms, and part of that is because of things like sleep apnea. One partner snores, the other doesn't. And then another really big reason is actually because women who are going through perimenopause and menopause want to be able to have the room at a very specific temperature, but their partner doesn't. Have you heard this?
Oh yes.
Yep.
And not only from that, it's I think since COVID that has a flow of through the rooms and be able, and of course the sleep apnea and my patients huge because there's usually one partner cannot sleep and they have to both works the next day, and I think that has becomes really, and they have to have the talk that so I cannot sleep and go tomorrow because you're snoring all night. So I think that's has become again an accepted thing that there was in, I guess, in 60s 50s was the trend, and now it's sort of back to having good night's sleep is so important for your health. So and be feeling comfortable to be who you are. So we have not got there, but hopefully we don't. But
I really like my bedroom setup as it is. I just feel like, well, we bought this California king size bed though. But I mean, obviously in my situation, we don't have the square footage, but I mean, it does make sense. It, like you said, with sleep apnea, or even let's say in couples that have very different career lifestyles. Like I think about myself. I mean, my husband is a surgeon. He wakes up really early. Guess who has to wake up really early too? The psychiatrist, the telepsychiatrist who worked from home. I'm a supportive wife. Shout out to John. I love you. but no, but it is kind of shifting, but it is a shift. And again, part of that is also cultural, and that is why it is important. Like you said, the joke, not the joke, the talk that maybe we do have to have a talk, and that can be something really supportive if that is an option. Yeah, I understand in many cases it is not an option, but we must prioritize our sleep. Sleep is so important. And again, I do believe I had mentioned it in the last podcast that I was on. I don't remember if I did. That's part of my maybe perimenopause is brain fog. But women actually require 10 hours of uninterrupted sleep compared to our male counterparts who do just fine with 7 to 8 hours. So that's the other thing, is that it's not just that you should be getting 8 to 9 hours of sleep. There is a difference, actually, especially with the hormonal fluctuations of perimenopause and menopause. It becomes more important than ever to shoot for 10 hours of sleep. I have yet to meet someone that gets 10 hours of sleep. And if I do, I don't really want to meet them. Must be good. I'm so happy for you if you're getting 10 hours of sleep. So I'm certainly not. But if you can, make it a goal. Shoot for the moon. If you fall, you land among the stars.
You mentioned something about, you said a few minutes ago about brain remodeling. Could you tell us about that? Because that's something that happens throughout our lives. And I always think about remodeling during infancy, childhood, teenage years, but not so much about in adulthood. Tell us about that.
I personally think my brain is always under construction. Part of my dust. So that's the interesting thing that we are seeming to talk about more is that your brain as a woman in perimenopause and menopause, and actually, again, we don't have enough data on it, but there are suggestions that it also happens in the postpartum period, that there is actual remodeling that does happen for these women. And that is a direct result of the shift that happens in your progesterone and estrogen, and how quickly and how steeply and how often these changes happen, because all these hormones are connected together at the end of the day. We see a lot of thyroid changes that happen as well in perimenopausal and menopausal women. If there are any history of thyroid changes or thyroid cancers in your family, typically it does tend to be around the perimenopausal or menopausal age that those issues start to creep up. And the problem with that is that it does actually affect your brain. You do get quite a bit of inflammation that happens within the parenchyma of the brain. Like, if you think of the brain and it's kind of that squishy thing, it's just very inflamed, and inflammation can make it seem like your head, that expression, your head is in the clouds. Yeah, your head does feel like in a cloud. It's in a cloud of inflammation, is essentially what it's in. That does remodel the brain over time. Maybe not in a favorable way. I'm not saying it's upgrading by remodeling. I'm saying it's adjusting. It is frustrating.
And also cardiovascularly, also in perimenopausal, yes, they will increase cardiovascular and their, atherosclerotic disease and plaques, isn't it?
Absolutely. So what we don't talk about is one of the main culprits that will get women in, and again, those changes start in the perimenopausal age where your risk factors start to go up, is heart disease. But we don't think about it, and we don't catch it often because heart attacks also look different in women. The symptoms are not the classic symptoms that you think of, where your chest hurts and your arm hurts and you feel like there's an elephant sitting on your chest. In a lot of women, they say my back hurts, or they say my sternum hurts, or my breasts hurt even. It's very different. Or they just feel like they're having the worst flu of their life. It looks different in women.
The reason I asked that question a second ago was because I've been, we've been medically induced menopause, and probably throughout my career, probably hundreds, if not thousands of women for breast cancer and other diseases. And just curious if you've seen a difference between symptoms and in those women who are having a medical menopause as opposed to a more natural one.
So you're saying the surgically induced versus the natural?
Surgically or medically induced with
chemical,
with LHRH agonists or other meds.
Correct. So that's a very good question. In fact, I actually had a patient today that we did talk about this, because my question for her was, when you say that you had a hysterectomy, did you have your ovaries removed as well? Because there is a difference. If you just have your hysterectomy, your ovaries are still going to play a part in giving you the menopause symptoms around age, again, perimenopause, as early as perimenopause, where you're 41 to 51 and you start to have those changes, versus if you had the ovaries taken out as well with also doing the hysterectomy, then pretty much you're done, because the hormonal changes already happened and it's done. I think that it also really does depend on woman to woman as well, because again, if you really think about it, and a lot of women don't talk about this, but again, when I go back to the thyroid, when you are usually around the perimenopause to menopause age range when the thyroid issues start creeping up. So that in of itself also will give you symptoms that are very, very similar to perimenopause and menopause. So it's so confusing because, yay, it's so great to be a woman. We have so many confounding factors that happen at the same time.
A lot of respect, because I can't imagine having to do that, cycling like that every month, and then all the other changes that happen throughout the life. It's a lot.
one of my patients says, if male have to have, a baby and go through all of those things, be an abortion clinic in every corner, and the population be very, very few.
Have you ever seen on Instagram that meme that depicts like a man in bed and he looks like he's dying? And then it says, my husband when he has the common cold versus, and it's a woman like scrubbing the dishes and scrubbing the floors. And it's just, you know what it is, you know what it is. And we all suffer as human beings. We all, it is difficult to be a human being. I think we can all agree on that. Um, I think that one of the takeaways I want your listeners to maybe walk away with is we will say it is very difficult to be a woman. It is very difficult. It has to, just like it's very difficult to be a man as well. But being a woman, yeah, it comes with we're constantly remodeling our bodies and all that, and it is challenging. However, if you can stop and remodel the way that you think about it as well, and I know, it sounds really woohoo, it's like, okay, yeah, sure, doctor. But it is also very beautiful. It is a beautiful thing to be able to say, my body is capable of doing these very, very, very incredible changes. And look at that. What doesn't kill you makes you stronger. Um, I certainly feel like having survived postpartum depression and having survived childbirth and having been in labor for a whole week, I definitely feel like I am super strong compared to the girl that I used to think I was. So I don't know. Maybe I'm stronger. Maybe I'm just like delusional, but it is a beautiful thing. It can be. Maybe I'm just tricking myself though. I mean, really, it is hard though. I'm just
Is the prism depend on what you look at it and how you perceptive. So I think for everybody's different, but it is challenging, and you have to be strong to survive those monthly things, changes, being a mother, worry about the kids and all of that. So my mother always says there's a special female, you're not you when I didn't have the kids, says you're not a parent, especially you're not a mother, because she could says I could feel if something wrong with you across the world, and I don't know how to explain it. So I have that. If she would call me, it says, and I knew there's something. I said, how do you know? It says, I'm a mother.
it's so beautiful. No, that is such a beautiful thing. And I am so, being a mother is not for everyone. I get that. I get that. But I will say that I give it a 20 out of 5-star review. I do, even with all the challenges. Being a mother, being a woman, if I could choose to do it over again, I'll be a woman again. I'm enjoying it. Like it's hard. It's hard, but I'm
I
really
salute to
enjoying it.
that.
Yeah.
I salute you.
Yeah. I'll take it again. I'll do it again.
Beautiful, beautiful. So how do we treat this physically as well as diet, medicine? Elaborate a little bit on that, what they can do and what can be done for them.
So here's a couple things. And it is a very sensitive topic. And these are definitely discussions to have also with your family and it seems to be that the opinion seems to change every decade as well. One thing you could do is hormone therapy. That is a very personal decision because that comes with its own risks as well. You can take the estrogen, you can take the progesterone, you can take all of that. There are also non-hormonal medications for your hot flashes and your mood that you can see a psychiatrist about. That's something I very often treat for my patients. There are very specific SSRIs, antidepressants, which can help with hot flashes very much. There are natural supplements that people will swear by. One of them being high dose of omega 3s. But again, just because it's a natural supplement doesn't mean that it's harmless. So again, that's something to also talk to your doctor about. Now, here's a really, really cool thing that's coming around the corner, coming to a theater near you. There is more and more literature coming out about the benefits of microdosing Ozempic or any GLP-1 antagonist for the treatment of A, weight changes for women, which happens, and B, apparently there is suggestion that perhaps it does help with lessening the hot flashes as well. It's all very new. What have you guys heard about it?
Well, Ozempic seems like a lot of they use it for so many different reasons, and the curve control of the appetite and many other things. I see a lot of side effects of it, but because I'm in GI, because I see gastroparesis, pancreatitis, gallstone, but it's definitely helping quite a few people. So I think if used appropriately, probably is good.
This microdosing is new to me. Could you tell us about that a little bit?
I learned about this actually, I think it was 3 weeks ago that the article popped up, and I clicked on it because I'm a woman. I live in Southern Orange County. Listen, I'm terrified of not being able to fit in my clothes. Okay. Full disclosure. But I clicked on it right away. So it turns out that, the starting dose of Ozempic, they come in the syringes and it's pre-measured, and, you know, that dose is really far too high for someone who doesn't meet criteria being, that you're obese or diabetic, and your body has to be at a certain place to be able to take that dose. Otherwise, that dose can make you feel very sick. That's just too much for your body. But what about the in between, where, what about the women that are not diabetic and not pre-diabetic, but they have done everything in their power not to gain weight, but during perimenopause and menopause, all of a sudden they're 10 to 15 pounds heavier than their body has ever been. And it doesn't feel good, and it doesn't feel comfortable, and it's ruining their quality of life. What about for those women? So it turns out that the pharmaceutical industry is trying to figure out a way to actually take that. I believe it's 2.5. If I remember the article correctly, it's 2.5 is the starting dose for that weekly Ozempic injection. And they're trying to formulate it that you can inject it they've already started doing this in Great Britain, actually. Inject every 2 to 3 days at tinier doses of the 2.5. But the way that the syringes are given right now to our patients here in the US, it's a one shot and all of it goes in to your injection site. But as it is in other countries, they're already looking at how to distribute that 2.5 over the course of several days in small, tiny doses, and that is actually being utilized for postmenopause, menopause, perimenopause weight gain. That doesn't necessarily make you obese, but it sure makes you feel uncomfortable, because a BMI of 20 might feel just fine to one woman, but maybe another woman feels more comfortable at like a BMI of, say, sorry, wrong number. A BMI of 22 might feel good for one woman, but a 22 BMI for another woman, like, she just doesn't carry that weight on her body the way that she's used to, and she'd rather be at a BMI of 20. So what do those women do? And they've done everything under the moon to try to lose that 5 to 10 pounds. They can't lose it. Well, what is your other option? Is, seeing my husband at the plastic surgeon's office and have it liposuctioned out. Well, not everyone wants to do that. I want to do that, but not everyone wants to do that. So that's where microdosing Ozempic is out on the horizon.
What do you think of the soy protein? Like in Asian, they have as much symptoms as the Western female. What was your thought on that?
Oh man, and the what you hear is so conflicting, because then you hear that if you have too much soy in your diet, then it can set you up for potential cancers, and that it can further disrupt your hormones. It's so confusing to me. And then I think that another conflicting issue is that the quality of food, in my opinion, and just the typical Eastern diet is very different than the Western diet. I'll be the first to say that the typical Western diet is really not a great diet. So I think that it's more than just the soy that's helping. Yeah, it's the lifestyle. It's the quality of the food. I don't, I mean, as it is, and we've already been talking about it, the hormones and the additives and the preservatives and the artificial food dyes that we put in our children's food here in the US, these things are illegal in other nations, made by the same companies. So a bag of M&Ms that you buy overseas doesn't have artificial food coloring. The ones that you buy in the US do.
we see it a lot in our patient with fatty liver as well as in a GI malignancy that we have never seen that younger age people that, in their late 20s, 30s, then the stuff that we never seen before. And it's all have to do with choice of the, early childhood food and nutrition and accessibility to it as well. Sometimes they have no choice to buy to this packaged food, the processed food. That's the only access they have. And I'm sure that affects through our life.
They're filled with hormone disruptors. Again, forever plastics, hormone disruptors. Avoid products that have lavender. Those are hormone disruptors. So you see those like calming lavender baby lotions and baby shampoos? Those are not allowed in my household. Lavender is not allowed in my household because it's a hormone disruptor. The water that you drink from the tap is a hormone disruptor. And all these things are now contributing to the fact that perimenopause seems to be happening earlier and earlier and earlier in Western American women. This is not a conspiracy theory. This is very true.
As well as hormone therapy and dairy and poultry products that they're go unregulated.
Yeah. Also, probably sperm count in men
Yep.
going down
Yep.
as well. It's probably this is not a coincidence at all.
Not a coincidence. And please, men, if you want to have children one day, be aware of jacuzzis, hot tubs, jacuzzis, really, really hot showers, all these things that, and again, it's being Iranian. I grew up hearing all the rules, but again, living with an American, I see that these are not rules that he hears of and that they're touted as myths. And I understand we're both physicians and we're looking at the science of it, but the thing is that the rules that I grew up with, I think that when you really break it down, there is a lot of science to it as well. Is yes, if you get in a hot tub and you're marinating your family jewels in a hot tub at very high heat, you're not doing your sperm any big advantages. So no, it's true. These are all hormone disruptors. We're surrounded by them in our society. Who knows what cell phones are doing? God knows.
Well, the ancient wisdom is based on long-term experience, and I think, and anything I read, whether from mindset or from whether daily living, when you go back, they have been there 1,000 years ago, in poetry or maybe in China or even in many ancient culture. This has been repeated. We forget about it, then we have to go back. Hey, they had the experience. They knew what they're talking about. So, but when you live fast paces, this when you're young and nothing makes sense. So, but when you get older, you get a little wiser. It's just maybe they were right. So,
honestly, I how many times a day do I say my dad was right? But growing up, for instance, for example, I remember growing up as a child and all the kids at school, they had the fruit roll-ups and they were eating Trick cereal and Gushers and just like, ooh, how much artificial food coloring were we giving kids, right? Well, it turns out that lucky me, I have an allergy to artificial food. Like I'll go into anaphylaxis. And I remember even before we knew to do allergy test, I didn't get allergy tested until I was in residency. Yes, those were a bag of peach rings from the Keck cafeteria at USC that sent me to the ER. But growing up, I remember my dad would always say, no, food coloring is awful. Soda is awful. Don't we can't have any of these in the household because it's poison, especially for a girl. It's poison for my body. And maybe one day it'll contribute to fertility issues or hormone issues. And I just always just think like, really, you just that doesn't make any sense. Very old fashioned. And now I look back and think he's absolutely right. Artificial food dye is not allowed in our household, but also I have the blessing that we have access to places like Trader Joe's and Whole Foods, and a lot of Costco products are also artificial dye free. Not everyone has that advantage, but these are lifestyle factors that play into it as well. So just drinking green tea a day because Japanese culture says to do so, or having a matcha a day, isn't going to be enough to change things radically for you. It is a lifestyle change. And there are some things that just aren't necessarily in your control. Women from the time that they're 13 to the time that they're in their 50s are using sanitary products like tampons and menstrual pads that now we know also have forever chemicals, which are hormone disruptors, which have been in very close proximity to those very, 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 very delicate organs. Some things you just can't avoid. It's unfortunate.
It is. What can you do? So you have to educate yourself and
absolutely
makes the wise choices.
Make the best choice you can, I guess.
Exactly.
Yeah.
Anything else in conclusion, and anything? How about medically, beside the SSRI and the hormone replacement? Anything else that you any advise the people that go through this menopausal period?
Do you use it? And do you use any of the new meds like the neurokinin meds? Do you like the Vioza? Do you use any of those new ones?
I haven't been able to use that in my practice. I have seen the articles. I can't really speak on those just given I haven't had experience using them, but I read about them quite often just to see. And I'll be honest with you because it's around the corner. It's just around the river bend. So I really want to know what all my options are going to be. So I have made it a priority to learn about these things and to be able to have discussions with my OB-GYN when the time comes. But also I'm educating myself about it because there are women in my mom, there are women in my life that are heading in that time of their life or have been in that time of their life or are in that time of their life. And I just feel like I want to advocate and be able to make the best decisions for all of us and, give the best advice that I can. But I'll be honest with you, we don't talk about it as a society enough. I'm a physician and I don't know all the options. So hopefully the more that we can talk about it, and thank God for podcasts like this, and honestly thank God for social media because of that reason. But I'll be honest with you, I don't have experience with those medications to be able to comment.
Well, thank you very much for your time.
And how could our listeners find you?
So you can either find me at my concierge practice at resultpsychiatry.com, or you can call 657-229-0776 if you would like to be in my private concierge practice, or if you'd rather go through your insurance, you can find me at United MD, and you can call 949-502-5572.
Beautiful.
Wonderful.
I greatly appreciate your time
Thank
and your
you.
wisdom. And it's always a pleasure talking to you.
Thank you for making me feel better about myself. These are very therapeutic for me as well, by the way.
For all of us.
Yeah, I had a lot of fun. So thank you.
Thank you.